Hello everyone, my name is Kayla Hersey and today I'm going to be presenting my case connections for Unit 2. The first problem I chose was case connection number 3. So a 5-year-old boy is brought to the pediatrician's office for an annual visit. The mother reports he has been a sickly infant and often appears drowsy. She also has concerns over her son's persistent thirst and urination. Blood samples are taken for insulin measurements at time 0 and 1 hour after a glucose loading test. The results of this testing are illustrated in the table below. And so the questions to address here are, what is this information likely to suggest about the underlying biochemical basis for this patient's symptoms? What would you predict the patient's fasted blood glucose levels to be given his current condition? And to also list 2 regulatory enzymes that are likely to be active in this individual's current conditions. So to address the first question, what is this information likely to suggest about the underlying biochemical basis for this patient's symptoms? I'm going to say that this patient is diagnosed with type 1 diabetes. Type 1 diabetes is a disease in which the body cannot produce insulin effectively. And this is due to loss of the insulin-producing beta cells of the islets of Langerhans and the pancreas. Symptoms for type 1 diabetes include frequent urination and frequent thirst, much like the mother had described in the symptoms. These lab results for baseline blood samples also show the abnormally low levels of insulin in the blood when comparing to the control sample. And so a little bit more about insulin is that it's a hormone in the body that is used to regulate the uptake of glucose. And so if this pathway is interrupted, glucose cannot be stored properly or absorbed, which will lead to increased glucose levels in the blood and also in the urine, which will also correlate with the symptoms that the mom had described. So to predict what the patient's fasted blood glucose levels will be given the current condition, I'm going to say that in the fasted state, the glucose levels are going to continue to rise above the normal range. In type 1 diabetes, glucose uptake and utilization are going to decrease. And so in the liver, ketone production, glycogenolysis, and also gluconeogenesis are all going to increase. And specifically, gluconeogenesis will be a key pathway that's affected in type 1 diabetes. And so a little bit more about gluconeogenesis is that it's a metabolic pathway that generates glucose. And in this case, it will generate too much glucose when comparing it to the insulin levels, which will lead to the hyperglycemia. And based upon this, 2 regulatory enzymes that are going to be active during this patient's conditions are going to be the 2 regulatory enzymes for gluconeogenesis, which we know are glucose 6-phosphatase and pyruvate carboxylase. Moving on to the second problem, I've chosen case connection number 4. So a previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports that she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reported these symptoms started. The laboratory results are consistent with hypoglycemia, but are otherwise unremarkable. Epinephrine is administered and there is no increase in blood glucose, but there is an increase in blood lactate. Physical exam reveals a liver edge 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirm the hepatomegaly or enlarged liver. Lastly, blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. And so based upon this information, which of the following is most likely the diagnosis of the patient? So we have choice A, B, C, or D. And so what is the most likely diagnosis of this patient? I'm going to choose choice C, and that would be the glycogen storage disease. Glycogen storage disease, or von Gurk disease, is described as a disorder that causes buildup of glycogen in the body's cells. And clinical features of this disorder would be glycogen accumulation in the liver and renal tubule cells, hypoglycemia, lactic acidemia, ketosis, and also hyperlipidemia. Particularly in this case, the buildup of the glycogen in the liver is causing the liver to not function properly, which will therefore lead to the enlarged liver, which was seen in the X-ray. In addition, this disease will result in, or this disorder rather, will result in lab work that shows low blood glucose levels, or the hypoglycemia, which was also described in the infant. And when doing some more research on this disease, it's also common that it occurs when an infant starts to sleep more or sleep through the night. And it usually would occur around 3 months old, which is similar to this infant's age. One of the symptoms of hypoglycemia is can be a seizure, which may also explain the jittery spells that the mom had described. And the enzyme that is deficient in glycogen storage disease will be the glucose 6-phosphatase. And so a little bit more about why this is important is that lactic acid is converted via the gluconeogenic pathway to glucose 6-phosphatase, and accumulation of the glucose 6-phosphatase, or phosphate, due to malfunctioning of the phosphatase will inhibit the conversion of lactic to pyruvate, so that will cause the high levels of lactic, as we saw in the infant symptoms. And so to talk about disproving the other diagnoses, so choice A, which was the hereditary fructose intolerance, we do see that there are similar symptoms with glycogen storage disease, but this is going to occur after someone has, or an infant has ingested fructose. So that's going to be anything that has like fruit juices, high fructose corn syrup, or anything else that would contain fructose, and we know that this infant has only ingested breast milk. Choice B, which was the galactosemia, would likely occur shortly after birth. It wouldn't be later on in the infant's life, like this 2-month-old. And the common symptoms for this disorder would be lethargy, vomiting, jaundice, diarrhea, failure to thrive, and none of these were mentioned as symptoms of the infant. And lastly, the glucose 6-phosphate dehydrogenase deficiency is going to also be incorrect, and mainly this is incorrect because it occurs exclusively in males. And in addition, this deficiency leads to hemolytic anemia, which would result in abnormal blood cell counts, and these would easily be found in blood work, but as we know, blood work was otherwise unremarkable for this infant. And just to go through, here are my references. Thank you for watching and listening.